every brain injury is so absolutely unique that there's really no way to predict with any certainty what the course is going to be going forward. The reason for that is a combination of the injury or trauma that's occurred, as well as the physiological makeup of that individual.
No two injuries are obviously exactly alike, and no two individuals are exactly alike. There are fundamentally 4 stages to an acquired or traumatic brain injury and its levels of care: physician visit or emergency room visit, the acute care and inpatient treatment, rehabilitation and post-acute care phase, and finally, the ongoing and continued rehabilitation phase.
If an individual suspects that they may have suffered a mild traumatic brain injury or a concussion, the most important thing to do is to get to your physician immediately and get checked out. If the physician determines that you're not in any immediate acute danger, but the symptoms are persisting weeks or months later, another possible avenue is to go and see a psychologist who specializes in brain injury recovery, as there may be psychological factors that are contributing, or there may be things that can be done in terms of speeding up the recovery process. Everybody thinks of the hospital, the ambulance or the helicopter brings you to the hospital. That's the acute recovery process. And then what the focus is at that point is in making sure that you survive the injury and that any acute medical kinds of emergencies are accounted for. Bleeding in the brain, pressure, swelling, those kinds of things.
He walked in my room and I was blue. I technically coded. They told him that I would never wake up again. They put me in ICU with a trach tube, and Joel started looking for long-term care, and a week later I woke up. I couldn't remember who I was. If you put me in my front yard, I couldn't tell you which was my house. I thought the biggest thing in the world was when I got to go to HEB in the evening again. I got my car keys back after about 2 years. I thought it was like playing hooky, getting my life back.
After a person is stabilized medically, the next step in the process, and you don't have to necessarily go through all of these processes in order, but the next step is what would be considered acute rehabilitation. In acute rehabilitation, the individual still has medical needs, and they need to be around doctors and nurses probably 24/7 to make sure that all their acute medical issues are being managed. After the acute rehabilitation process, what comes next is often post-acute rehabilitation. In post-acute rehabilitation, the person is what we call medically stable, but now they need intensive rehabilitation. Physical therapy, occupational therapy, speech therapy, cognitive therapy, and psychological therapy to kind of work on the deficits that a person is experiencing. Rehabilitation from a brain injury is a lifelong process, and it's not uncommon that an individual will go home after post-acute rehabilitation and some problem will come up. Either it's a daily living problem or a work problem or something that they need additional help. So really the post-acute rehabilitation process can go on indefinitely.
He was an inpatient for the first 6 or 7 months, I guess, post-stroke. Then he discharged home for about 2 months while we were waiting for surgery, and then went back into a rehab after his surgeries for I think another month, discharged home again. During that time, he ended up getting really sick, and I was unable to work all full time and take care of him as well. So we did use a nursing home for a while.
Working with your doctors and your care team and really figuring out where would be the best place to go is really, really important. There are a lot of really great residential facilities where they may have a continuum of care. You can have more hospital-like setting if you need more nursing care, maybe you're on a ventilator, up to individual apartments, or even just kind of check-in community type style. You might just stop by every now and then for financial assistance. A lot of these facilities are very expensive and they might not be close to where you live. And so that's where the waiver programs can come in, making it possible for you to take, your son or daughter, your husband or wife home and allow them to live with you in your community with their family, and making all of those adjustments possible.
The bathroom was redone because we had a tub, and their community-based assistance program allotted us to be able to put it in, because it was torture having to wash her hair in the sink, and so that it was a lot easier. Yes, it was.
As you're progressing through rehabilitation, you're going to be getting closer and closer to returning home. And so instead of putting off all of those things to think about, it's really important to start working on applying for programs. And it's going to be a difficult time. It's going to be a busy time. Thinking one step ahead is always going to be helpful so that you're not suddenly the day before they're going to discharge you and you don't have a plan and you don't have a place to go. But no matter what, if you get stuck, the Office of Acquired Brain Injury is here to help you navigate where to go next.